My name is Dr. Joshua Berka, Medical Expert Center here at BEMER USA. In today's webinar, we're going to be reviewing the fundamentals of the BEMER signal, applications and usage guidelines, as well as some frequently asked questions. You should always consult your own physician and/or primary healthcare provider if you have any medical concerns. BEMER therapy is intended to be used to enhance the general blood flow. And by enhancing the blood flow, you support the body's nutrient and oxygen supply as well as waste removal. This enhances cardiac function, physical fitness, endurance, strength, and energy. BEMER is also excellent for prophylaxis or prevention. As you increase blood supply to various tissues, especially the brain, you can support and enhance concentration, mental acuity, reducing the effects of stress, and further supporting relaxation. BEMER also has a sleep program which helps with the circadian rhythms, the natural circadian rhythms, for those individuals who wish to have help managing sleep. So our body works most effectively when we have the nutrients, when we have the oxygen delivered to the cells, and the waste products, these metabolic waste products, are properly removed. And this all occurs due to a healthy cardiovascular system and, of course, a functional circulation. When this process becomes disrupted, disease or dysfunction manifests or occurs. BEMER is the most researched PEMF system on the international market, and so many people want to know or understand, how is it that this works? Why is this the case? And it all starts right here. The fundamentals of BEMER's effect comes from the unique waveform or signal that it uses. The BEMER signal was created back in 1998. And as you can see here, this is the mathematical formula that gives rise to this unique multidimensional complex sinusoidal waveform. Its effects, though, on the left side you can see an example of different waveforms which have been utilized in the past by traditional PEMF devices. You have the sinusoidal, trapezoid, triangular, sawtooth, and double sawtooth waves, but their pulses only reach a certain segment of cell frequencies. Notice on the right here the broad range of the BEMER's waveform. And this unique waveform has 5 international patents and reaches millions of cells within the body. When comparing these various forms, you can see even the most complex wave on the left side has maybe 300 stimulations per second versus BEMER's 1,200 stimulations per second. That means more signal to more cells, more effect. In addition to the signal and waveform, the BEMER has a unique electromagnetic field distribution which enables the BEMER to affect multiple cellular processes simultaneously. And while BEMER does exhibit multiple effects, the BEMER's PEMF, the electromagnetic field, has a profound effect on the body's systemic circulation, or what we call hemodynamics, blood movement. And how exactly is this happening? The waveform or the signal is one aspect, but the manner in which this is delivered through timely variation is also very important, and the frequencies that BEMER deploys to positively affect the blood flow through the body are 10 and 30 hertz. The 10 hertz ultimately affects the larger caliber arterioles via direct nerval effect, and the 30 hertz affects the smaller caliber arterioles through the stimulation or production of nitric oxide, or NO, which, as we know, is a vasodilator. Therefore, the BEMER displays its effect through a neuroendocrine mechanism of action. The BEMER comes in a couple different models here. These two models are the professional, as you can see in the front, and the classic models. These are the brains of the BEMER box, or also known as the B box. And the first and most obvious distinction between the B box classic and the professional is the touchscreen interface on the Pro system versus that of the classic, which has raised interface buttons that you can physically touch. On each system, you have levels 1 through 10. You have programs 1, 2, 3, as well as sleep programs, for instance, on the classic, S1, S2, S3, that can be set for 6, 7, or 8 hours for the sleep program, respectively here. And for the Pro, you have programmable timing that you can utilize for the sleep program. A lot of people always ask as well, what is the frequencies that a BEMER uses with the AC current? Well, BEMER is plugged into the wall. When it's plugged in, it uses an AC current, and that AC current or alternating current is converted to a DC current, and then that is used to drive the BEMER signal with the 10 and 30 hertz as we discussed. As we know, as I discussed before, the BEMER patented waveform uses a complex sinusoidal proprietary combination of 10 and 30 hertz to stimulate optimal blood flow and positively affect systemic circulation. Important to note also that the BEMER switches polarity about every 2 minutes so that the body does not accommodate to a unidirectional field. The BEMER Pro comes with a B body, the B grip, the B spot, the B light, and the B pad. The BEMER Pro is by far the most diverse BEMER system available on the market. It can control and run any combinations of 2 body mats, applicators, whether they're different or the same, and or applications of 2 B bodies simultaneously operated. And you can do this together or controlled independently of each other using either a selected level or a program. For the professional system, you can even program your own programs into it. And it's these unique features which is why many home users and practitioners, they make the choice to buy the professional and utilize it either in a home healthcare or a clinical setting. Also, it's good to note here that the B body, the B spot, the B pad, and the B light may be used simultaneously with each other with the professional model. I'm going to say this again because this is a very big distinction between the two. So if you're utilizing this and you want to be using the B light or B pad with the body or other applicators together with different or the same programs, then the BEMER Professional is the system that you should choose. The BEMER Classic. The BEMER Classic comes with a B box, the B body, the B grip, and the B spot. And while there are 2 magnetic connectors for both the BEMER Classic and Pro, the Classic can only run 2 body mats simultaneously on the same level or program, but cannot run 2 of the same applicators or 2 different applicators simultaneously like the professional system. Whether using the Classic or whether using the Pro system, it's really quite simple. Lie down or lay back, sit down, you select an intensity or a program, push the start button, and relax. It really is that simple to use. The 2 complementary applications of BEMER are 1, the general improvement in circulatory parameters. So it has systemic effect, and this is accomplished with the full body applicator, the B body, and it should be the basis of every single application. On the second aspect, use of the special applicators according to one of the 10 intensity levels, or ideally the 3 programs, for superficial up to deep localized effects, and this is more of an adjunct to the general therapeutic effects of the B body. So as I said, the B body, according to the basic plan, which we will discuss here soon, is the foundation for every form of therapy, for the general improvement of the circulatory parameters as well as other therapeutic effects as well. The application depends on the individual. There are no programs or protocols for this disease, this condition. BEMER does not use any protocols for any specific disease, as BEMER is a Class 1 FDA registered device. So it's important to understand that the application depends on that unique aspect of the individual. Application should be twice a day plus the sleep program, and in cases of acute situations or acute injuries, more than a single application can be indicated, and usually is. It's important to know that the therapy should also build from lower intensities to higher intensities, and the more impeded someone's circulatory state, the lower the intensity that should be applied, especially initially. The metabolism of people who are elderly or sick or suffering from other conditions really has to be taken into account because these individuals can be compromised, and therefore you should not overstress their bodies. So the general full body therapy, the full body application is carried out with the B body, and this follows the guidelines of the basic plans, and this is outlined in the user manual. As soon as someone gets a BEMER, you should absolutely invite them to read the BEMER user manual rather than just jump and start using the BEMER. It's important to understand the equipment that is being used. And this basic plan is designed to improve the general circulatory parameters and support the requirements that are necessary for metabolic processes and self-regulating mechanisms. As I said before, you can use additionally other applicators either simultaneously or after the B body, and you can even do the B body in successive applications. This is the B body right here, and it's rolled up, but when we look at this unrolled, you can see here this young lady with the child. The BEMER has 4 coils, and 4 are located in the upper torso and 2 long ones in the lower area of the legs. And while these effects of the BEMER signal configuration, they've been scientifically proven and they're essentially pretty much independent of external influence, it's still important to follow some of the guidelines we're going to talk about here to really optimize your personal results. I've been using the BEMER for a long time, and while I've not heard of any negative effects, I usually will have my patients remove credit cards and watches before the BEMER. I always tell them make sure you're in a comfortable position, avoid wearing tight or constricted clothing. You should always choose an area or a room with comfortable temperature. Avoid stress or distraction. Turn your phones off, turn the television off, and so on. The other thing, you should abstain from coffee or tea or anything with caffeine in it before applications. You should also refrain from smoking cigars, cigarettes, pipes, chewing tobacco, or even nicotine gum, for example, before application. Something you should do before application is drink a glass of non-carbonated water, mineral water, spring water. You should do this before and after the application because proper hydration really is vital to not just your life and essentially your health, but it will help support the clearance of metabolic waste through the body. You can see this individual here lying on her back. While it's best to lie on your back when using the beam body, you can assume any position of comfort that really suits you. And the goal here is to have the most surface area in contact with the bee body as possible. Here's a good time to bring this up as well. If you look here, you can see the bee box. As I said, the brains of the BEMER. This is not plugged in to a power outlet because this one is running off a lithium battery, which is an optional addition to the BEMER. And it's really an excellent way to stay mobile with your BEMER system. So again, you can lie on it in any position you want. You can lift your knees, other parts of your body. Sometimes people stretch on the BEMER. But it is important to know that the electromagnetic field decreases in intensity or flux density exponentially with distance. So to make it simple, if you move further away from the source of the field, the less the signal strength you'll receive. And with that being said, there's many times that I will use the BEMER on my treatment table clinically while maneuvering a patient around using other physical modalities or other type of treatment applications. So whether you're just relaxing on your BEMER or reading a book, you're still getting the benefits of its application. The intensity levels, as we're going to go through the basic plan here, are set up in this way. Level 1 or 2 has more of a calming and relaxing effect, and I generally recommend that everyone starts on these lower levels. Levels 3 to 6, this is really following the basic plan, and this is for most individuals. 6, 7, 8, these are for my top athletes, people who are in excellent physical and mental capacity, younger individuals, and 9 and 10 levels, intensity levels. These have the most penetrating effect. I'll also say that more is not always better in this case, and most of the research studies have been done within the parameters, within the intensities of that basic plan. Speaking of the basic plan, here it is, and this is outlined in the user manual. Basic plan application with the bee body should generally be carried out twice a day. And only after the second cycle or after 6 weeks, starting with 1 time per week, the sleep program can be gradually introduced. And you can increase the treatment by once a week application. This procedure here with regard to the sleep program is also recommended for long-term BEMER users. Even if someone's been using the BEMER for a while, it's not recommended, and when I say using the BEMER, meaning here or there, it's still recommended to follow the basic plan. New users, certainly using the sleep program, if you're not up to using the sleep program, you can use level 1 without the plus signal during that first cycle before going to sleep. And again, level 1 is very low, 3.5 microtesla, no plus signal, and again, that can have a very relaxing effect for people just before bed. The first cycle of the basic plan lasts 6 weeks, and the following cycles are only 4 weeks. You should begin with level 1 and increase each level per week up to level 6, and after that 7th week, begin a new cycle, returning back to level 3 as outlined in this diagram here. So there's 2 complementary applications. One is the general improvement in circulatory parameters using the bee body. Number 2 is using one of the special applicators according to one of the 3 programs or one of the intensity levels, either to go superficial or to deep localizing or focal regions, as an adjunct to the general therapeutic effects of the bee body. Looking at the special applicators or the second application, these are designed to penetrate into local regions, and there's different applicators for this. The bee spot, for example, is more of focused areas. It's smaller. The bee pad is very versatile, long, flexible, and it covers larger areas. The bee sit is also a comfortable seat, and we're going to go through all of these in a few slides here. This is more of a focused region, but larger than the B spot, and of course the B light is for superficial regions, and this is the phototherapy aspect of the BEMER. While it's generally recommended to use the B pad, B spot, B sit, these special applicators after the B body, they can be used during the application of the B body. Also note that these are excellent if you don't want to carry your full body mat with you when traveling, or if someone is an ambulatory and they can't move around, handicapped people, these are great to bring with you if mobility is what you're seeking. The local penetrating effects of these special applicators, these are created in targeted areas using either the spot, the B pad, or the B sit. Again here, note that the magnetic field decreases to the second power of distance. So the further away you go away from the BEMER, the less the power is, and therefore these coils in the applicators were configured stronger than the ones in the B body. In general, 3 different programs were developed for varying these penetration depths. These are Program 1, Program 2, and Program 3. And keep in mind that these levels can also be used with or without the plus signal with the applicators. Program 1 is levels 2, 3, and 4, using 2 minutes level 2, 2 minutes level 3, and 4 minutes level 4. These are for more superficial applications, maybe if you're trying to penetrate through the hands, the wrist, or other areas. I mean, even in the chest, if you put the B spot and you use a level 3, which without the plus signal is 30 microtesla, that is plenty of flux, plenty of intensity to go through the chest wall, chest cavity. Program 2 is 4 minutes of level 2, 3, 4, and 6, totaling up to 16 minutes, and a 20-minute program, Program 3, which uses levels 6, 7, 8, 9, 10, which has the deepest penetrating effects. The average maximum flux density or intensity of BEMER signal with the B spot, the B pad, or the B sit without the plus signal is 100 microtesla. And when you turn the plus signal on when using them, the maximum average flux density is 150 microtesla. And keep in mind, these values are on the maximum level of 10. The same is true with the guidelines for the special applicators. The programs are fixed sequence of increasing intensities, as we discussed in the previous slide. The intensity levels are fixed intensity over time, 8 minutes, unless you program them. And the goal is additional local effects, and this is achieved by applying these applicators to individual regions. And these localized applications are to support the B body and its effect on systemic circulation, as well as the local application directed towards target tissues. The B spot's a small applicator, and this connects to the B grip, and this can be used for smaller regions, smaller applications. You can either use it by strapping it on to a region, like you see this gentleman has the B spot strapped to his arm, or you can physically hold it in place, and this can assist in the delivery of the BEMER signal to the desired target tissue or area. The B pad is one of my favorite applicators, and its flexible multi-coil delivery system delivers the BEMER signal over a larger region, and it can be wrapped. It can ultimately be used by lying on it, sitting on it. You can drape it over a region, as you can see here. This woman here, you can see, is lying down, draping the B pad over her leg, and there's 3 coils that are in the B pad, evenly spaced apart, when it allows you to move the signal or the wave directed towards larger regions. Many times I recommend wrapping the B pad around someone's waist or orientating vertically up the spine to support the optimal blood flow over these larger regions. The Velcro strap that's with the BEMER pad, it's a really great feature that allows the user to fix the B pad in place, and it also enables for mobility when it's active. There's some times where I'll be using the BEMER with an individual, and I'll be having them stretch, move, breathe, and it's very nice to be able to have the pad actually able to stay on the individual so it doesn't fall off using the Velcro strap. The B sit's nice. It's a soft, comfortable cushion, has a single coil in the center, and the B sit, it's excellent for those people who sit a lot at a computer chair or someone who is an ambulatory in a wheelchair. It's also great for portability when someone doesn't want to bring the full body when you're traveling. And over here on the right, I'm taking a look at this. I'm not advocating at all sitting slouched like these images on the right. In fact, rather sitting at your computer should look more like this. And this is a good time. I want to bring this up because ergonomics at the workstation is one of the single most important parts of whether someone leaves work in pain or discomfort, how much energy that takes to be at work. And if someone is using the BEMER and, for instance, they have low back pain or muscular tension from using a mouse or a computer, the truth is you are not going to get changes in this situation if people don't change their work environment. And that goes across the board, not just for ergonomics at work, but for lifestyle. BEMER is an adjunctive support to individuals' lifestyle choices. The B-Light is the only phototherapeutic applicator that the BEMER has available. It's an extremely bright light. It's a light-emitting diode, or an LED, and emits a pulsating monochromatic red light with a wavelength of 660 nanometers. And this makes the B-Light an ideal supporting application for helping with healthy skin as well as supplementary aspect to cosmetic applications. The B-Light complements the user's benefits of the BEMER therapy by means of something called photobiological or photochemical light mechanisms. And through this light effect, the B-Light promotes the regeneration processes of the skin. I found the B-Light to be really helpful for many dermatological conditions that I see in my clinic over the years. And it's also great if someone's had post-surgical procedures and they're trying to help eliminate or diminish scars. While the B-Light's been a superb clinical tool for me, many people use the B-Light for its cosmetic anti-aging effects to help tighten the skin, help support reducing wrinkles, dark spots, as well as strengthening the underlying collagen. And this can help give a youthful glow and really help enhance the suppleness of the skin. As you see here, it's always recommended to use the protective goggles that come with the B-Light standard when it's being used on any part of the body. It's also important to note here that the B-Light must be used directly over the skin. It will not penetrate or have an optimal effect if the skin is covered with a bandage or through clothes. It does have to be in view of the target tissue and not necessarily right in contact, but as close as possible with no barriers in between. BEMER's also included something called the BEMER scan, or the B scan, and it's located on the back of the B box with both the Classic and Pro sets. The B scan here is integrated into your BEMER box, and it's designed to check the BEMER devices along with safety precautions for the proper function. That's what they do. This makes the multidimensional BEMER signal configuration audible so you can hear it. And it's also ideal for when you're displaying or demonstration tool for interested individuals, because when the device is switched on, you press the button. This gives an audible sound that detects the electromagnetic signal, and the BEMER scan, B-scan, automatically switches off after 10 seconds. Like I said, the BEMER scan, the B-scan, is excellent for demonstrations either with individuals or in group settings, but it's not in no way form a diagnostic or a treatment device. The only thing that B-scan does is it checks to see if the EMF is being generated by the BEMER. It can be used with the B-Pad, the B-Mat, the B-Spot, the B-Sit, all applicators except the B-Light, which does not use a pulsed electromagnetic field, actually uses the 660 nanometer LED monochromatic red light. I want to talk a little bit about the sleep program. But before I do this, it's important to know what's happening in the circulation throughout sleep and wake cycles. We have diurnal variations in our sleep and wake cycles, and these are governed by circadian rhythms. Melatonin, cortisol, these shifts play a vital role in maintaining homeostasis and health. And it's one of the biggest issues for a lot of my patients is they don't sleep well. BEMER recognized this and created the sleep program to help support individuals who are seeking a more restful sleep. The regeneration process is mainly occurring when you sleep, and it's considered a very important aspect, especially for people in rehab, elderly, people very susceptible to infections. In fact, a lot of times being asleep is more important than the waking hours for people trying to support regeneration. So the BEMER sleep program helps generally increase the effect of the daytime use or the active. It can help with the immune system. It can actually support the regenerative aspects or restorative processes of the body, and help to clear out the excretion of waste products, an acidic substance from the body. Very simple. It uses level 2. Instead of using the combination of 10 and 30 hertz. It uses just the 10 hertz. And it's on for 2 hours when falling asleep and on for 2 hours when waking up. Whether that's 6 hours, 7, 8 hours you sleep, it's the same. And it's enough to bring and support the body to bring them into a deep sleep and help gradually bring someone out of sleep in the morning in the 2 hours before waking. So the BEMER does have an outstanding spectrum of effects, and it really changes the characteristics of full body circulation. BEMER works to improve concentration, mental acuity, reduce the effects of stress, stimulates better blood flow through the entire body, and assists in the clearance and disposal of metabolic wastes. BEMER promotes relaxation. BEMER supports cardiac function, enhances physical fitness, endurance, strength, and energy. The nice thing about BEMER is it's effective for long periods of time, has virtually no side effects, and is very easy to use. The frequency of application is based on the user's available time and the therapeutic requirements. You can certainly use more than one application spread throughout the day. That's considered optimal. In an acute situation, you can do multiple applications, which can be beneficial. I want to sit on this slide for a second so you can understand what's going on here. This is the start low and go slow slide. The older an individual, the more affected or impeded their circulatory state, the lower the intensity, not the higher. More is not better here. So always start on the lower levels and work up. The goal of the applications here is to activate as many blood vessels as possible, enhancing the systemic circulation and supporting cardiac function. And most blood vessels are located superficially, so the B body is that primary cornerstone application that should be used and started with. The more severe the metabolic state of the user, the lower the level that should be applied. And the goal of each therapy is the improvement of metabolism. Therefore, begin at these lower levels and work up, increasing in intensity.